Hi everyone, this is Anita with the Lens Academy. So today I'm going to talk about coronary arteries and how to identify the location of different types of MI. Okay, so let me begin with coronary arteries. If you look at the picture, you can see there is a right coronary artery and left coronary artery. The right coronary artery supplies the right atrium, right ventricle, and inferior portion of the left ventricle, then the posterior septal wall, SA node, and AV nodes. Okay, so it mainly supplies the right part of the heart. Okay, and some part of the left ventricle, that is the inferior portion of the left ventricle. Okay, and the next one is and then the right coronary artery branches to right acute marginal artery. So you can see this one, this is the right acute marginal artery, and this is the posterior descending artery. Okay, so posterior descending artery or PDA and right acute marginal artery. Okay, and then the left coronary artery, it divides into left anterior descending. So this is the left anterior descending and the circumflex artery. The left anterior descending artery, this supplies blood to the anterior wall of the left ventricle and the anterior ventricular septum. Okay, the anterior ventricular septum. So there is a septum that divides the ventricle. So it's this the LAD supplies blood to the anterior ventricular septum. Okay, and the apex of the left ventricle. Okay, apex of the left ventricle, and it branches to left diagonal artery. Okay, so this is the left anterior descending artery, and then it branches to left diagonal artery. So this is the left diagonal artery. Okay, and then the circumflex artery, the circumflex artery supplies blood to the left atrium. Okay, to the left atrium, this is the upper portion. Okay, so it supplies blood to the left atrium and the lateral and posterior surfaces of the left ventricle. So the lateral and the back, okay, the posterior surfaces of the left ventricle. Okay, and it branches to left obtuse marginal. Okay, left obtuse marginal artery. Okay, so these are the coronary arteries. So if you have to learn about the different types of myocardial infarction, you have to learn about the coronary arteries also. Then only it will be easier for you to understand the location of MI. Okay, so next one. So to understand the location of MI, we need to understand the 12 lead EKG placement. Okay, so when it comes to 12 lead EKG leads, there are three limb leads. The limb leads are lead 1, lead 2 and lead 3. Okay, lead 1, lead 2, lead 3. Then three augmented leads, those are AVR, that is the right one, AVL, that is the left one, and AVF, that is the foot one. Okay, three limb leads, three augmented leads, and then six precordial leads. Those are V1 to V6. Okay, so three limb leads, three augmented leads, and six precordial leads. Okay, so move on to the EKG lead placement. Here you can see one goes to right arm, right leg, left leg, and then the precordial leads V1 to V6. Okay, so the V1 is the only one that goes into the right side of the chest. Okay, so it is placed in the fourth intercostal space to the right side of the sternum. Okay, then V2 goes in the same line towards the left side of the sternum, that is fourth intercostal space towards the left side of the sternum. Okay, so V1 and V2 both are placed in the fourth intercostal space. Then V3, it is between V2 and V4. Okay, So V4 is placed in the fifth intercostal space at the mid-clavicular line. Okay. So V4, V5, V6, all these are placed in the fifth intercostal space. So V4 is placed at the mid-clavicular line. Then V5 is placed at the left anterior axillary line. V6 is placed on the mid-axillary line. Okay. So fourth and fifth intercostal spaces. Okay. So understand the location of the lead placement, then it is easier to understand the location of MI2. Okay. Okay, so let me move on to the localization of MI. Okay, so when it comes to the leads V1 to V6, that is the precordial leads, and it is all placed in the anterior wall of the chest. Okay, so V1 to V6, the problem, it localizes anterior MI. Okay, and the artery that is affected in anterior MI is LAD, that is left anterior descending. Okay, then you can separate the anterior into anterior septal and anterior lateral. So V1 to V4, that is septal MI. V4 to V6, that is lateral, that is because it is towards the lateral side of the patient's body. So the V4 and V6 views the lateral side of the heart. Okay, in all the anterior MI, including the septal and the lateral, the artery affected is LAD, left anterior descending. Okay, and then if there is an EKG changes in V1 to V6 and lead 1 and AVL, okay, lead 1 and AVL and V1 to V6, it is called extensive anterior MI, and the artery involved is LMCA, that is left main coronary artery, that is left main coronary artery. Okay, so this is very serious issue. Even the LAD is also a serious issue. Okay, then lead 1 AVL, V5 and V6. Okay, so when I talk about these leads, you have to remember the placement of the leads. Okay, so the lead 1 AVL, V5 and V6, it is viewing the heart to the lateral side. Okay, it views the lateral side of the heart, so it is lateral MI, and the artery affected is left circumflex. Then lead 1, if there is only lead 1 and AVL, it is high lateral. Okay, highly towards the lateral side, and the artery involved is left circumflex. Okay, then lead 2, lead 3 and AVF, all these are towards the bottom of the patient's body. Okay, so that is inferior, and the artery affected is RCA, that is right coronary artery. Okay, and if there is an ST depression and prominent are in V1 and V4, okay, ST depression and prominent are, then it is posterior MI, and the artery affected is right circumflex. Okay, so this is all about the location of MI. Hope you will understand. Thank you for watching.